My name is Gary Moorfield. I'm the Vice President of Technology here at MyCare Medical.
My name is Thomas Morrell. I'm the Director of Clinical Applications at MyCare Medical.
So let's start out with big keynote announcement yesterday. What are you most excited about? What are you going to adopt? Or what are you not going to adopt?
I think everything we're going to adopt because
Right.
we already have Sino, so there was a lot that we saw out of that, and we can leverage a lot of it to benefit the providers that are already struggling trying to use it, and it will actually enhance their user experience with it.
Well, I think the one thing that got me really excited was the announcement of the Sino dictation area and stuff. One of the challenges that we've had with Sino was really not Sino itself, but it was some of the issues we've had with the ECW dictation pieces.
Yeah.
And while we have been waiting on some enhancements with that, now it kind of all makes sense that with the introduction of Sino dictation. So for me, I kind of want to feed off of that and get those providers won over to that, off of the ECW dictation, get them off of Dragon, please, and go full forward with Sino.
And I'm going to add in there. I mean, why not be excited about Halo Genie either? I mean, we're getting ready to do that one, and we're excited about that one. Leveraging against all of 36 of our clinics will be an amazing experience.
Being one of the first adopters of that too has got us really exciting. Telephony AI is a huge piece of all of healthcare right now, and I know when I've been talking to my other colleagues and stuff throughout the country, no one's nailed it. No one's nailed telephony AI in healthcare yet. So Genie with the full integration with the EMR is going to be an exciting event here.
Yeah.
Well, let's talk about the Genie. Let's talk about your current environment. I'm assuming you're using some sort of cloud system currently, probably, or UCS. And then let's talk about what you currently have in place and then what you expect to see with Genie.
Yeah, I mean, we definitely got the traditional UCS and use it in like the IVR framework and such. A lot of those solutions have introduced AI, but there's very little integration you can do with that. We're really not using any of the integration pieces right now because it's really a hit and miss of what the integration pieces you're going to have with the EMR. And there's your challenges with it and stuff. I mean, yeah, you could have a scheduling feature with those systems, and it can create a telephone encounter. But really, that's it. It's very limited and stuff. But that's where Genie, I think, has got us really excited.
And I mean, just even listening about the campaigns and stuff that Genie is going to present, that there's a lot of things that our operations is already asking of us that we can't do that, but it will help us, deliver some of the things that they're asking.
Exactly, and I'll tie on to that too. Is one of the things with the integration piece with telephony AI that you got to have is you need that AI presence to be able to dive into the patient's chart that can translate that information over to the patient, so that if you're really going to use AI to take the burden off of the offices themselves, you need that integration. And the traditional AI that the other companies that are big with UCS provide, they can't do that.
So one of the trends that I'm seeing is a lot of these third-party bolt-ons may slowly disappear because they're features that's being put together by EHR vendors. But Genie specifically, it may even transform the UCS world for smaller organizations or clinics with less than 100 clinics, right? That could essentially be your UCS platform. Is that something even on your mind in terms of that could be a potential replacement or not there?
So that one I'll take because if you ask Thomas, I'm sure Thomas will be like, yeah, let's go all in and stuff with that, with the integration with the EMR and stuff. So I've been doing healthcare IT for over 30 years. And the one thing I've learned is with the introduction of new technology, you can't go just rushing in there and stuff. And so while a lot of AI is going at light speed, for those that like sci-fi, it's ludicrous speed, right? But I see a lot of potential with it replacing the traditional UCS. I really think it's got the capability of taking it completely over. There's a piece of me that just won't see AI succeed with that, but I'm also being very cautious because we've also seen where AI is very limited, where AI is still learning and stuff. And what you don't want to do is leap in with both feet and have some of those mistakes, whether they're visibly seen or behind the scenes that are hidden, to pop up and impact the patient's care or patient's how they interact with the clinic. That we definitely want to enhance, not to bring down.
Correct.
So with that thought process change, let's give this scenario. Let's say a traditional UCS player decides to embed a product that's directly integrated with the EHR. Does that change the mindset?
I'm not going to say it wouldn't, but I can tell you from what we've looked at. Well, here I'll just share the story. I know eClinicalworks leadership kind of knows the story. Is that before the conference last year in 2024, I had been working with 3 different UCS vendors, and I literally had the contract, the final contract on my desk that after the ECW conference, I was going to be signing in with one of the UCS vendors, and we were going to be jumping in with telephony AI with some of the limited integration with eClinicalworks. And after Jeannie was introduced, I literally came back and said, Thomas, we've really got to look at this because this is a game changer. And that's what we did. We kind of put the pause button on that particular partner, and we started talking to eClinicalworks and Jeannie. Trust me, I'm telling you, the UCS vendors are absolutely going to try to take this business back. They're going to try to hold on to the business and stuff. And I just think that they're never going to be able to get the full integration that Jeannie can do. It's never going to happen.
And it's both ways. With Genie and Sino, you see these vendors out there trying to do the same things, trying to leverage the same technologies. But the problem is, at the end of the day, it's about simplifying the workflow for the user. Making it easier for them to do their job. Because the less you have them going out of a system, easier it is to get the stuff done. And that efficient workflow is exactly what we're looking for, especially the way costs are these days.
Biggest operational challenge that you foresee with some of these new tools, adoption challenges, or what's your tips on adoption?
Wow, adoption is a tricky subject. I think with anybody that's been in healthcare for a little bit.
Let's use Kiosk. So Kiosk is a perfect example. And we struggled. We went live last year, and we went full board. We bought stands, everything, and they just were not. But once we taught them, we got them to work with the patients and stuff like that. They started all of a sudden, 3-4 months in, started getting heavier adopters and stuff like that. Sometimes it's just working with them and talking to them of the why. Because if you can't get that why through, they don't want to do it. And that's the big things we saw.
Yeah, the why I think is very, very important. We talk about that in all of our trainings and stuff. Adoption, I think that's the key to adoption to your teams, is explaining the why. Absolutely. Now, the patients, they don't care about the why. They don't. The adoption by the patients, that's a bigger challenge. And the biggest thing that I would suggest with that one, especially with the kiosk, we will have the same thing with telephony AI, I promise you, is we just got to keep working with the patients that these technologies are to help you and make it to where you're not on hold for 10, 15, 20 minutes, right? Make it to where you can get to that solution or get that appointment scheduled a whole lot quicker than sitting there waiting on the front desk to get a moment to call you back or whatnot. Yep. So I think that's going to be the biggest challenge. Teamwork, the team members and stuff. I agree with Thomas. That's always been a challenge for us. The one thing I'll say with regards to the kiosk that we did that I thought really helped us out a whole lot is we did a little internal contest. We got with some of our technology vendors, and we had some donations come in. And for the great clinics that adopted very well, we actually had giveaways and stuff like that. And what we've seen is even since that contest ended, we've seen our clinics just continue. They realize the impact that the healow check-in, the healow portal, getting the patients signed up and engaged, not just signed up, but actually engaged with the portal, with the chats and stuff. They've seen the impact of that. So me and Thomas both have been just recently looking at those numbers, and we're still on the incline and stuff. So that's a big win for us this year.
Thank you. Final thoughts. If you had one wish for the product that's not in existence today, what would that be?
And I can't think of it because,
You're implementing so fast. You just
and that's the thing, we sit here and say, well, we think we could save for the future, but the thing is you got somebody like ECW that's already kind of light years ahead of these other EHRs, so it's hard to compete and say, hey, this is what I think what should happen. I mean, you want to say things like Heal Insights. It would be great to push higher, limits and get more peers involved. And so if I had to say something, that'd be a big wish right there, because that you have less than spreadsheets that you have to upload manually to get the data into ECW, injecting it, right? But I think that's not just an ECW thing. I think that's just a technology thing across the payer world.
Yeah, I think that's actually what I was going to say is I like the power of Healer Insights and stuff, and I think that's the biggest challenge is getting all the payers included. And I think partnerships with CMS and some of the regulations we see coming out next year is going to definitely help with that. And hopefully ECW is ready to get those people on board and get that data ingested into the system.
All right. Thank you guys so much.
Thank you.
Thank you.